Assalamualaikum and very good morning. Today, our group will show the complement visitation test. What is a complement visitation test? It is a blood test which is a serum sample added to a particular antigen and complement to discover whether antibodies to that particular antigen are present. The nature of complement is to counter in combination with antigen and antibody complex. Develop the complement visitation test. Complement visitation test developed by Jules Bordet. Bordet did observation and research about Pfeiffer phenomenon and conclude two factors responsible for bacterial killing, which is heat stable factor and heat sensitive non-specific substance that only act on sensitized organ. Then Paul Ehrlich, a German bacteriologist, named that non-specific substance as a complement. In 1899, Bordet discovered which complement are present in serum hemolysis of RBC, and if RBC added after bacteriolysis, hemolysis this did not occur because free complement bound to antigen to antibody complex. Is the complement visitation test used? First, when to determine virus antibodies in patient serum or cerebrospinal fluid. Second, when to do accurate measurement of IgG antibodies. As positive control that if the antibodies in patient serum to add in diagnosis of four specific fungal diseases, which are histoplasmosis, blastomycosis, coccidioidomycosis, aspergillosis. Is the CFD pathway. Based on this picture, we can see two different pathways with different test results. So the first step for the complement visitation test is an antigen and patient serum are incubated with a limited amount of complement. The complement will be activated or fixed by the antigen to antibody complex. If the serum contains a specific complement and activating antibody, however, if there is no antibody in the patient serum, there are no formation of the antigen to antibody complex, and therefore the complement will not be fixed and will remain free. Next, the second step detects if complement has been utilized in the first step or not. There will be no complement left to fix to the indicator system. If the complement is fixed in the first step because the presence of antibody, however, if there is antibody in the patient serum, there will be no antigen-antibody complex, and the complement will be unfixed and free in the mixture. The unfixed complement will react with the antibody called SHIP RBC to cause the lysis of SHIP RBC cell. Thus, we could see the observation for complement visitation test is hemolysis will occur in absence of specific antibody in patient serum because complement has not been used, which lyses the synthesized RBC and giving hemolysis result. However, if the patient serum contains antibody that react with Ag to form Ag and AB complement, then fixed complement so no complement available to hemolysis synthesized RBC and giving no hemolysis result. Why is the CFD test done? Complement visitation test done to detect increased titer of antibody, identify contemporary and past infection. Second, to detect IgG and IgM antibodies. Visitation test consists of two components. First component is an indicator system that uses SHIP RBC cells combined with complement-fixing antibodies such as immunoglobulin G, produce against the SHIP RBC, and then add with complement. When all of these elements are mixed, the anti-SHIP antibody will bind on the surface of RBC cells. Then complement bind to this antigen-antibody complex form and will cause the RBC cell to lyse. Secondly, component is test system. Patient serum will be added to the non-antigen and also complement added to the solution. The antigen-antibody complex will bind all of the complement. If the serum contains antibody to the particular antigen, then SHIP RBC cell and the anti-SHIP antibody are added. If complement not bound by an antigen-antibody complex, so it is available to bind to the indicator system of SHIP cells and anti-SHIP antibody. Lack of antibody in patient serum causes lysis of the indicator SHIP RBC, which indicates negative result. However, if the patient serum does contain a complement fixing antibody, it will result in positive complement visitation test. What are the advantages and disadvantages of CFD? The advantage of CFD is capability for screen against a bigger number of viruses, also at the same time for bacterial infection. Secondly, economical. For disadvantage, firstly, it's not sensitive, which is cannot be used for immunity screening. Then time consuming. Thirdly, always non-specific, example, cross-reactivity between herpes simplex virus and varicella zoster virus. All of reference that we use to get information about CFD complement visitation test. The end, and thank you for watching.